In the last video, we talked briefly about subdural hematomas, and in this video, we will continue that talk. What we're really going to focus on is this pooling of venous blood on top of the brain and what effect that might have on your health. The cranial cavity is a closed system. It has a fixed volume. The cranial cavity houses the brain, blood, and cerebral spinal fluid. When the volume of one of its components rises, a decrease in volume of its other components occurs. The volume of brain tissue, blood, and cerebral spinal fluid exerts a pressure within the cavity known as intracranial pressure. If the components inside the cranium maintain the same volume, the pressure within the cavity should also maintain the same value. Anything that is within the cranial cavity that should not be is called a space-occupying lesion. So our initial head injury has led to a space-occupying lesion. If a space-occupying lesion, like our subdural hematoma, gets too big, it can cause a raise in intracranial pressure. Before continuing on, let's go over this one more time. A traumatic head injury caused by rapid acceleration-deceleration forces can result in a space-occupying lesion like a subdural hematoma. The word lesion refers to anything abnormal. The venous blood that is collecting in the subdural space is abnormal. The cranial cavity is rigid and not very spacious. Thus, the venous blood, if not stopped, will start to push down on the area of the brain tissue directly below it. The continual rise of intracranial pressure is significant. Let's take a look at exactly why. About 20% of the blood pumped by the heart goes to the brain. As intracranial pressure rises, the blood vessels supplying blood to the brain will get increasingly compressed by this new pressure. As the intracranial pressure continues to rise, the blood vessels supplying blood to the brain continue to get more and more compressed. Thus, less blood is getting to the brain. This also means that less oxygen is getting to the brain. This can lead to hypoxia in the brain. And remember, hypoxia means oxygen supply to a tissue is insufficiently low. When cerebral hypoxia sets in, normal brain functioning will decrease. Thus, the brain will not be able to produce the level of consciousness it normally does. Levels of consciousness are measured by the Glasgow Coma Scale. 15 is the score when fully conscious. The higher the intracranial pressure, the lower the GCS score will be. One last thing I need to mention before we go. Rapidly increasing intracranial pressure as well as angular acceleration forces can produce retinal hemorrhaging. These traumatic events may cause the layers of the retina to slide over each other, which produces shearing in retinal blood vessels that may result in bleeding.